Welcome to the video series titled Buyer's Remorse. Today is part 2, subtitled Market-Based Medicine. Now, in part 1, we saw what nationalization of our healthcare system will do to Americans and to America. We, the people, need the opposite of nationalization. We need market-based medicine. The Democrats' plan to nationalize healthcare will create a system we can't possibly afford, where the federal government makes our medical decisions for us, we don't, where Washington bureaucrats spend our money, not us, and where a multitude of Americans will die waiting in line for care. Obviously, this is not what we were promised, and most certainly, this is not what we want. Interestingly, the Bill of Rights shows us how to fix our healthcare system. The 10th Amendment reads as follows: "The powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectively or to the people." Powers here means authority or control. United States refers to the federal government. So, the 10th Amendment says that healthcare should not be under federal authority. It should be controlled by the states or by the people. The solution is, in fact, the exact opposite of nationalization. It is what I call states care, capital S, capital C. The book, Curing the Cancer in U.S. Healthcare, States Care and Market-Based Medicine, explains in detail how this works, and in a minute I will give you some specifics. But first, the way for Americans to get affordable medical care when we need it starts by kicking Washington out of healthcare entirely. Repeal all healthcare mandates, phase out Obamacare and Medicaid, and pay out the Medicare Trust Fund to people who have paid into it. And no, I'm not crazy, quite the opposite. I want to return control of our healthcare to where it belongs, to the hands of American patients. According to polls, Californians want single-payer system. Oregon residents prefer their version of universal health care. New Yorkers apparently like Obamacare, and Texans say they want a market-based system. Those 92 million Americans, and in fact all 330 million of us, should be free to choose whatever system we want. We should not be forced to accept what Washington dictates. States care returns the right to choose to we the people. In part 1 of Buyer's Remorse, we listed the elements of nationalization, such as a national health budget, price and wage controls, elimination of private insurance, an expanded bureaucracy, etc. Also in part 1, we saw that nationalization doubles our tax burden, at least, takes away our right to choose, and makes us wait so long for care that Americans will die waiting in line. Now, let's look at the elements of a market-based medicine system and see what those elements do to us and for us. Market-based medicine includes large family HSAs, affordable, timely care, direct connection between a doctor and a patient, and catastrophic insurance for high deductible, that is, high priced, medical disasters. Here is how market-based medicine works. Last year, the average American family spent $28,166 on healthcare costs, almost all of which went to insurance companies. Now, imagine you could put all that money into your family HSA, a bank account with no limit, no restrictions other than you have to use it for medical care, and one that you can pass on to your children or your grandchildren. You, the patient, are in control. You shop for your care. Sellers compete for your dollars. You choose your provider. You choose your care. As I say, with market-based medicine, you are in control. No federal bureaucrat is spending your money or deciding what care you'll get or even if you'll get it. Now, in the current system, the third party in between you and your doctor takes away your right to choose. The third party, Washington or an insurance company, is making your medical decisions and spending your hard-earned dollars. With market-based medicine, there is no third-party decision maker. You and the doctor are directly connected. You make the decisions about your care, and you decide how to spend your money. You are looking at an organizational chart of the bureaucracy created for the Affordable Care Act. Each symbol in the chart represents hundreds, thousands, or sometimes tens of thousands of bureaucrats. You pay their salaries, you pay their pensions, you supply their offices, computers, and their insurance premiums. The cost of all this bureaucracy is more than $1 trillion a year, and not one of those dollars pays for medical care. With market-based medicine, that cost of the federal healthcare bureaucracy simply goes away. We can recoup trillions of dollars currently wasted in the name of, quote, healthcare spending, end quote. You can use this money to pay for timely care of your choice, or you can keep those dollars in your pocket instead of giving them to Washington. Either way, with market-based medicine, we, the patients, win big. For more on this subject, please read Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine, and definitely check out the wonderful audiobook that we just released. If you have not already subscribed to the website We Can Fix Healthcare, check it out at deanwaldman.com. That's Dean with an E. My mother did that to me 77 years ago. Just click on the blinking icon on the top right. There is no charge for all the bonus material. In fact, encourage your friends and neighbors to subscribe. And finally, be sure to subscribe to my YouTube channel to view the latest videos. Just click on my image to your right. Thank you for watching and for being part of the cure for our sick healthcare system.